you. I would like to thank the organizers for inviting me here. It's really very exciting to be part of this meeting and to know that the Cochrane Collaboration is actually serves as a model for other knowledge networks. So it's nice to know. Now, as you can see, I've put my affiliation with CEBAM, which is the Belgian Center for Evidence-Based Medicine, which represents the the Belgian branch of the Dutch Cochrane Center. So I'm the director of the Belgian branch. But I've also put my clinical affiliation, and I think it's important to understand how the collaboration works, because you have to realize that my daily work, I'm a full-time clinician. Okay, so my everyday work is with patients, and Cochrane is more like a hobby of mine. So I will start my presentation with this slide, just to emphasize that the collaboration is about this. It's about patients. And this is my work. Okay, I'm a neonatologist, so these are my patients, prematurely born babies. But this is actually how the Cochrane Collaboration started off. And I'll just tell you a short story about this, because babies are sometimes born prematurely. They suffer from problems with the lungs. They need mechanical ventilation because of the immaturity of the lungs. They have bleeding in the brains. A lot of bad things happens to them. And actually, the early 70s, some researchers found out that if you gave a certain drug, corticosteroids, to the mother, to the woman who was really at risk for delivering prematurely, you could actually prevent or at least decrease the risk of these lung problems and the bleedings. And actually, it was a small trial, was not very clear, but more trials followed, like 10, 12 trials. Some of them showed some benefits. Some trials were not very clear. But 15 years later, almost none of the obstetricians actually used that treatment, because none of them realized actually what was out there as literature, as evidence. And it was only in the early 90s someone said, well, maybe it's a good idea just to summarize all the studies that looked at that problem. Prematurely born babies, if we give corticosteroids to women at risk of preterm birth, can we improve the outcome of preterm babies? And actually, it showed to be a very efficient treatment. It decreased the risk of death, of lung problems, of bleeding. So it really was very efficient to improve the outcome of preterm babies. And it took us about 20 years, because simply we were not aware of the evidence that was published in journals. And a lot of babies actually missed a very effective treatment. So that's actually the start of the Cochrane Collaboration. And Archie Cochrane was an epidemiologist in the UK, mainly active in the 70s and 80s. And he realized, he was very much aware of our ignorance about our knowledge about treatments in healthcare. And now we're talking about early 70s, late 70s. So he wrote an essay in the late 70s. He said, well, it is really a great criticism of our profession that we have never organized a summary of all relevant randomized control trials by specialty or subspecialty and adapted periodically. And that's actually the whole key idea of the Cochrane Collaboration. So having this in mind, in the UK, some people at the National Perinatal Epidemiology Unit said, well, let's start improve the world. And they started building up the Cochrane Collaboration, but step by step. And as you will see as we go forward, you will see all the elements of the Cochrane Collaboration falling together. So first of all, I say, well, if there's so many trials out there, we have to look them up and we have to make a register of all the trials. Now we're talking about perinatal trials, trials about pregnancy and childbirth. So that was the topic at the beginning. So that started to make a register. That's one element of the Cochrane. But I said, well, it's not enough just to make a register of these trials. You have to summarize them. You have to make an overview of evidence about one specific topic, one specific treatment. So they say, well, we have to make systematic reviews of all those randomized trials. Then they say, well, it's a huge job. We really need more people to do that. So they start to look outside the UK and say, well, maybe we should work together and find more people to make more systematic reviews. So the idea of an international collaboration came up. And then they published the trials and the systematic reviews in an electronic journal, which was then called the Oxford Database of Perinatal Trials. But then I said, well, we should keep this up to date because it's useless to publish it once and then it's not updated. So you have to keep it up to date. So a maintenance of systematic reviews, control trials was the next step. And these are actually all the different elements of the Cochrane Collaboration coming slowly together. And then the structure came of the Cochrane Collaboration. It started with one center. Okay, so in October '92 in the UK they say, well, we will create here a center, which they called Cochrane Center, because the idea came from Archie Cochrane. Within that center you had people interested in pregnant childbirth, but other people were interested in with difficulties getting pregnant, so in subfertility. Neonatologists such as me, we were interested in the outcome of preterm babies. So they grouped all those people in different, what they called review groups. Okay, so we had a couple of review groups. And then finally, October '93, the first international conference, which they called the first Cochrane Colloquium, was organized. And that was actually the time where the Cochrane Collaboration was officially launched as an international collaboration. At that time, not only the UK, but they found a couple of other countries like Canada, the US, Norway, and a bit later the Netherlands, Australia, and so on. And of course, the topics started to get larger as well, not only about babies and pregnant women, but also about stroke, about musculoskeletal review groups. So other review groups just came along. So that was actually the way the Cochrane Collaboration was slowly formed in structure. And then, of course, they came up with a very nice logo, which actually represents the two C's of the Cochrane Collaboration. So you have two C's of Cochrane Collaboration. And then in the middle, there's a graphic presentation of a meta-analysis. Okay, so this is a forest plot. And this is actually the forest plot of the systematic review about corticosteroids for women at risk of preterm birth. So they consider this as very clinically important, so they use it as their logo. Now, 2012, the Cochrane Collaboration counts almost 30,000 people over in more than 100 countries. The goal is still the same. We try to help care providers, policymakers, and patients to make well-informed decisions about healthcare, but based on the best available research evidence. And we create the evidence by preparing and updating systematic reviews and publishing them and making sure that they are accessible. Now, how is it structured? Well, in 2012, it is quite complicated, but I won't go through that slide. I'll just try to make it a little bit more simpler. Actually, there are a number of what we call Cochrane entities, and I'll explain some of them to you in a minute. So Cochrane entities, they all have a certain function, a certain reason, and then the glue between the entities is the steering group. Now, first of all, the Cochrane centers and branches. They represent the Cochrane Collaboration within each region, locally. There are about 14 centers, and these are the blue ones. The blue ones are the centers, and the red ones are branches. Now, branches are attached, linked to a center. They're not a full center, but they do have a number of responsibilities of centers. What do centers and branches do? Well, we promote and represent Cochrane Collaboration locally. For example, here in Belgium, we have a Belgian branch. We serve as a source of information, so people who want to know about Cochrane, they go to the Cochrane Center or the Cochrane branch. We provide training and support for authors, so people who want to be involved, make a systematic review. We help them. We give training courses. We support them during their process of making a systematic review. And we promote accessibility to Cochrane Library. So we try to disseminate the Cochrane systematic reviews to everyone who might be interested. So here in Belgium, we have the Belgian branch. We are linked to the Dutch Cochrane Center, and that's actually what is how Cochrane is represented in Belgium. So that's a very important entity, the Cochrane Centers. Now, a second one very important entity are the review groups, because these are the people who actually make the systematic reviews. Now, Cochrane review groups, they're not geographically localized. Of course, they're somewhere at a center localized, but they are composed of people from all over the world, but with the same interest in a certain topic. And they are, let's say, coordinated by an editorial team. So the people involved in review groups make systematic reviews, and the editorial team kind of coordinates the whole process of making those systematic reviews. There are many, many review groups. So everyone in healthcare who is interested in making a certain systematic review about a certain topic, he will find a review group where his or her topic will fit in. So that's actually the way it goes. If you have an idea, you make contact with a certain review group to make the systematic review. So these are two very important Cochrane entities. Which other entities do we also have? Fields. Sometimes some groups are not represented by a review group. For example, for me as a pediatrician, systematic reviews about children are scattered around all the different review groups. So they created a child health field. So all pediatricians are grouped together in a field. So they can communicate, they can discuss, they can make priorities for topics, for example, for systematic reviews. So there are many reasons to do that. Primary care, so general practitioners, nurses. So there are many ways, many groups that need to be grouped in another way. We try to improve the methodology of meta-analysis constantly. So we have a lot of methods groups thinking about methodology of meta-analysis. And we have a consumer network. We really try to involve the patient, the consumer, very strongly in the collaboration, and they have their own website, which is the CCNet. Now, all those entities are represented in the steering group, and the steering group actually sets out the strategy of the whole collaboration and makes sure that all the different entities communicate with each other, so that all entities have the same idea of working and the same follow the same strategy. Now, the most important product of the Cochrane Collaboration are the systematic reviews. These are high-quality overviews of existing evidence. They're published online or on a DVD. They are published every month now. It was every 3 months a couple of years ago, every month now. And to date, we have like more than 5,000 systematic reviews in very different areas of healthcare. So that's the important output. And this is the Cochrane Library, how it looks like. Now, how do we collaborate with these almost 30,000 people? Well, it's not difficult to understand that internet has been very important in the development of the collaboration. The website contains all the information you need, all the links you need to have to find the software, to find review groups, centers, etc. It's all on the website. And a lot of communication between collaborators is simply through internet, Skype, telephone, etc. All these kinds of communication. So that's, for example, our website with the contact details of review groups. A second important change in the last 7 to 8 years was the use of a central server. It's called Archie. It's actually the interface between the collaborators and the administration, and interface between collaborators as well. For example, it manages all the reviews. So all the reviews are on a central server. If as an author you want to work on your review, you check it out of the server, you work on it, you check it in again. And so it's a very efficient way of working globally. So this is an example of the server. It's me being logged in. I'm in the Belgian branch. I'm in the neonatal group, in the child health field, and so on. So you find all your different affiliations are there when you log in. And finally, we do meet. Okay, it's not only through internet. We do meet. We have an annual big Cochrane Colloquium, which is really a very big happening. It's open to the public, so everyone can come to the Cochrane Colloquium, and there is also a mid-year meeting, which is more like a management meeting for the steering group, the directors, etc. So the Cochrane Colloquium is not only a scientific meeting, it is also a social event where you meet up with your collaborators, where you try to organize all kinds of meetings with methods groups, with review groups, etc., etc. It's very exciting, and this year it's very far away. It's in New Zealand. Now, what makes the Cochrane a successful network? There are a number of things that the Cochrane Collaboration actually points out as reasons for success. I think the first one is the fact that within the collaboration, all partners are equal. So those 30,000 people are people with different training, different backgrounds, different expertise, but they are all equally important in the collaboration. So the product, the Cochrane Systematic Reviews, are produced by, but also relevant to, everyone who is in the Cochrane Collaboration. So that's the reason why everyone is so enthusiastic to keep it going and to make more systematic reviews, because it serves our own clinical practice. So equal partnership is very important. Second, there is no such thing as an office of the Cochrane Collaboration. There's no geographical boundaries. Of course, there are centers and review groups. They are located in certain countries and cities, but actually it's a global network, and that's also a very strong point. So each entity is actually a kind of mini organization that has its own funding, its own rooms, own websites, own staff, etc. Third, we are independent. Okay, the Cochrane Collaboration does not accept any funding from commercial companies or conflicted funding. So we're independent, not for profit, and we are funded by a variety of sources. It's different from country to country: governments, universities, hospital trusts, charities, and so on. So many different funding sources. Next, there is a democratic leadership. All the different entities are represented in the steering group. So it's very clear, and so these representatives, they serve for 1 or 2 periods of 3 years, and they are democratically elected by all the collaborators of the Cochrane Collaboration. So it's very transparent and it's very democratic. And finally, we have a very high quality of Cochrane systematic reviews. So Cochrane systematic reviews are considered as the gold standard of systematic reviews for within the area of healthcare. Now, the reason or the way we do that is, first of all, the methodology is very strict, is very transparent. It's really written down in a Cochrane handbook, which is very detailed, which is available free on the internet, and which is updated from time to time. So that's one reason. So this is, for example, the online version of the Cochrane handbook. Second, we use software that has been developed by the Cochrane Collaboration itself. So it's called Review Manager. It's version 5.1 now, but the result is that every systematic review of the Cochrane has the same content, actually, the same format. So it's very recognizable, and it's very constant. So that also guarantees a kind of quality of each systematic review. And finally, the process of making a systematic review is peer-reviewed. Not only the review itself, but also what we call the protocol. So if we only think about making a systematic review, we write down a complete plan of how we will manage to make that review. Now, that's called the protocol. Now, even that protocol goes through a peer review cycle of the editorial group, the review group, before you can even start making your review. So it's a very close dialogue with the reviewers, with the editorials of your review group. So it works very efficiently, but still there are a number of important challenges as well. And the Cochrane Collaboration actually sets out 4 important challenges that they continuously want to meet up with. The first one is to keep up with the high standard of the systematic reviews. They are considered as the gold standard, but it's not easy to keep up that standard. So we have to invest continuously in improving methodology of systematic reviews. We have to be sure that the people who make, the teams who make systematic reviews, have someone with enough methodological expertise. We provide training to authors. We provide support to authors. So when they make a systematic review, they come to us, and then we just guide them through the whole process of making the systematic review, just to be sure that that standard is very high. A second challenge is accessibility. It's useless making systematic reviews if they are not read and if they are not used in clinical practice. So we have to try to disseminate the knowledge from systematic reviews as much as possible. Now, some countries have, now you probably don't know that an individual subscription to the Cochrane Library costs you about $350. Okay, so that's a limitation. A lot of people won't pay that. So some countries have organized a national subscription. Ireland, UK, Australia, Canada, Denmark, there are many countries now. Here in Belgium, has not been possible yet, but with our Center for Evidence-Based Medicine, we have developed a digital library for health, and the Cochrane Library is integrated in that digital library. It costs you about €100 a year, which is not a lot. And Cochrane tries to disseminate content of systematic reviews in, let's say, the more modern ways, like videos, podcasts, webinars, Twitter, Facebook. All modern aspects of internet are used to spread the content of systematic reviews. The structure has to remain transparent, and that has been a challenge because the Cochrane Collaboration has been outgrowing itself. So it has been a real challenge to keep the structure transparent and efficient. So it's important that entities are accountable to some kind of monitoring organ. For example, Cochrane Center and branches, we have to fill in a monitoring form each year to show that we meet up with all the different things we have to do as a center or as a branch. So accountability is very important, and communication between entities, so that entities know from each other what we do. And finally, sustainability of the Cochrane Collaboration is also a big challenge. Okay, finding money to make it function. There is some central funding coming from the subscriptions of the library. It serves for the management system, for the websites, for administration, but each entity, like centers, review groups, have to find their own funding, and it is really a challenge. For example, here in Belgium, our center is funded by the Minister of Health. Every year we have to knock on the door and try to have our money for the next year. So it's really very hard and very challenging. Certainly because we cannot accept any commercial funding. So these are the four challenges, and the Cochrane Collaboration actually writes down a strategic plan that they revise every 2 to 3 years, where they set out a number of strategies in order to meet those challenges. So I'll end my presentation with this slide, just to show you that actually the Cochrane Collaboration is like a big family. As Miranda Compson from Australasia Cochrane Center stated, she said, well, being part of a collaboration is more than just a publication or job. It's a network of colleagues, advisors, and friends that spans the globe, and it's an incomparable opportunity to learn, collaborate, and share with amazing people. Thank you.